Now, exactly what is delegation? Delegating, by definition, is transferring to a competent individual the authority to perform a selected nursing task in a selected situation. The nurse retains accountability for the delegation. So some key phrases here. To a competent individual, a selected task in a selected situation. That's delegation. So when you tell your CNA to do ADLs on Mary, that's delegation. Supervision is different, related but different. Supervision, the provision of guidance or direction, evaluation and follow-up of the licensed nurse for accomplishment of nursing tasks assigned to unlicensed assistive personnel. So in other words, delegating is telling them to do the ADLs on Mary. Supervision is then going up afterwards and making sure that the ADLs were done. Were they done correctly? And was everything else done in the proper manner? You can't delegate without supervising. If you don't, you're doing half the job. And that is how problems happen. So that's delegating and supervision. So what can you delegate? Well, first off, just like in the rights of medication, there are the 5 rights of delegation. Right task, person, communication, supervision, feedback, and circumstance. Remember, you can't delegate to a CNA to go start an IV, but you can ask the CNA to empty that Foley. Possibly, CNAs can maybe DC Foleys if they've been trained, so that'd be the right person and right task. So the task you can delegate is a nursing task that you are able to supervise. So can you delegate the insertion of chest tubes? Well, I can't. I don't know how to put them in. So I certainly can't delegate that. You can only delegate what you can actually do. If you can't do something, you can't supervise it. You can delegate an assessment or evaluation, but you need to make sure that you understand, is there a need for clinical decision making? If a person, let's say telemetry calls you and says, the person's having runs of VTAC, should you delegate to a CNA to go check the vital signs? Well, you can. But if they're having runs of VTAC, do you think maybe you should go assess? Yeah, probably should. Make sure that you delegate if it has the right time and for the proper complexity of the patient. Again, checking person for VTAC, that's a nursing task, not a delegatable task. You have to delegate to the right person. Now this is going to differ based on job description, agency policy, and legal requirements. In some facilities, CNAs can DC, IV, or saline locks and Foleys. Others, they can't. In some facilities, they can get vital signs. Others, they can't. So you need to know what is the correct task in your facility for the person you're delegating. You need to make sure that the person is competent. Have they been trained? And does the person actually have time? It is unfair to delegate tasks to a person who already cannot get their job done. Because all that will do is either skip other jobs or do a very poor job on all of them. So what can you delegate to an LPN? There's a lot of questions about that. And the actual answer is, according to the state, you can delegate anything to an LPN provided 3 criteria are met. Have they been trained in the task? Does the facility allow it? And are you, as the RN, willing to stand by and supervise and take responsibility for their action? So LPNs can start IVs. LPNs can give IV push medications. LPNs can hang IV antibiotics. But have they been trained? No? Then you can't delegate that. Does this facility allow it? No? Can't do it. And are you, the RN, willing to assume responsibility for their actions? No? Okay. So that's what you can delegate to an LPN. And that will vary state to state. So what do LPNs, practical nurses, do? Performance of simple acts in the care of convalescent, subacute, or chronically ill, injured, or infirm persons, or any act or procedure in the care of a more acutely ill under the specific direction of a registered nurse. So in general, an LPN is going to take care of the less acutely ill people. That isn't to say that they can't take care of very ill people. But in general, an LPN or an LVN, licensed vocational nurse, that's the term used in some states, will take care of the less acute people. So what do we consider complex and basic situations? This is going to seem pretty obvious. Are they clinically predictable in what's going to happen to them? If not, complex. Are you getting orders constantly that are changing, titrating medications up and down? That's not basic, that's complex. Are you giving a medication that's an IV drip and you're constantly, like with heparin, constantly changing based on lab values? That's not basic, that's complex. So that's how you define who's a basic patient and who's a complex patient. Complex patients, it's going to be all you as an RN. Basic nursing care, again, this is care that can be followed with a defined nursing procedure with minimal modifications. So performing ADLs, that's basic nursing care. Passing oral medications, basic nursing care. Dressing changes, most of them, basic nursing care. So those are all things that can be delegated out. What about assessments? Can you delegate an assessment? Well, it depends. LPNs actually are not allowed to assess data. They can't do an assessment, but they can collect data. Now that is a fine line, but the difference is an LPN gets the data, but the RN takes action based on it. So LPN might get a blood pressure, and the blood pressure is 80/40. Reports that to the RN. Now the RN takes that data and creates an action based off of it. So that's the difference. Planning, RNs develop the care plan. Nurses assist, or LPNs assist. But let's not take anything away from them. LPNs know what's going on. So if you are working with an LPN and you're working on a nursing care plan or a plan of action, listen to what they have to say. Because a lot of times they know what's going on, especially if they've worked in that unit for a long time. Interventions, again, LPNs provide basic nursing care. They can do delegated tasks, and they reinforce teaching by the RNs. RNs, you're the person who will delegate it or do the more complex tasks. You will probably be delivering the high-level tasks, and you'll be doing primary teaching. Supervision. Well, RN, you are going to be supervising the other people on your team and the patients, and you'll be evaluating the effectiveness of all their acts. LPNs don't actually supervise. They manage and direct the nursing care of other LPNs and unlicensed personnel. So they manage, they give assignments, but they don't supervise, which is the evaluation, assessment, and feedback. Evaluation, again, we just talked about that. RNs, you will evaluate everybody around you and give feedback and corrective advice if needed. LPNs, they assist with gathering the data, but they don't actually do that feedback. Let's come back for part 3.